Welcome back to What Veterans Want You to Know. We partnered with military culture expert Psych Armor on this educational series so we at Kaiser Permanente can better serve veterans and their families.
Although no two veterans are alike, there are certain health conditions you may encounter when working with former members of the military. In this video, we'll discuss tips on how to recognize and support veterans with traumatic brain injury, post-traumatic stress, and post-traumatic stress disorder.
One of the invisible wounds of military service, traumatic brain injury or TBI, is caused by any blow to the head, which can occur from falls, accidents, penetrating wounds, or exposure to explosions during training exercises or combat. A traumatic brain injury is classified as mild, moderate, or severe, depending on if and how long people are unconscious or experience amnesia, confusion, or disorientation after their injury.
Mild TBI, known as concussion, is most common and not life-threatening. However, more serious injuries can lead to long-term complications, coma, and even death. It's important to recognize and screen for symptoms of TBI in order to determine the severity and treatment if needed.
After a traumatic brain injury, it's common for people to experience headaches and fatigue, as well as nausea or vomiting. They might feel dizzy, off balance, or sensitive to loud noises and bright lights. These symptoms can last a few hours to days or even weeks after the injury. People with TBI also report feeling like their thoughts are in slow motion. They may struggle to remember new information or find it difficult to concentrate, read, or perform other tasks. It's also common to experience intense feelings after a traumatic brain injury. People with TBI may cry easily, feel irritable, angry, anxious, or depressed.
Finally, be aware that patients who have recovered from TBI are still at risk for complications from subsequent injuries known as second impact syndrome.
When working with veterans, it's a good idea to check in regarding traumatic brain injuries. Ask your patients, during your military service, were you ever knocked unconscious? Did you ever experience amnesia, confusion, or disorientation after a blow to the head, a fall, or explosion? And if so, for how long? And finally, did you ever see stars or get knocked off your feet?
Post-traumatic stress, or PTS, and post-traumatic stress disorder, or PTSD, are caused by traumatic events. Within military service, these can include combat experiences, sexual trauma, and training accidents. For many, PTS can be compounded by trauma experienced prior to or apart from service.
Trauma affects every veteran differently, whether they deploy to a combat zone or not. Some military service members will develop the symptoms of PTSD. Others will not. If you're a caregiver, you may notice your veteran patients using the term PTS rather than PTSD. That's because service members use PTS more commonly to describe the trauma experience.
This is a deliberate attempt within military culture to not talk about an individual's response to trauma as a psychiatric illness or disorder. The hope is to minimize the stigma that keeps many military service members and veterans from seeking mental health care. When symptoms of PTS continue to negatively impact a person's life, PTSD may be diagnosed.
Your veteran patients may be affected by their past experiences. However, the goal of treatment is not to erase painful memories. Many veterans want to remember them because they include a legacy of friendship, courage, loyalty, sacrifice, and love.
It's important you convey to the veterans you work with that post-trauma growth is possible. Acknowledge their journeys, encourage them to take on new challenges, and celebrate the growth they find on the other side of trauma.
At Kaiser Permanente, we believe in equity and inclusion for all. With an informed awareness of military culture, we're better equipped to provide the exceptional care, support, and resources our veteran patients deserve.